Do individuals become refractory to a specific drug or an entire class of drugs?
Do individuals, when they become refractory to a treatment, is it to that particular drug or is it more like a class effect, that entire class of drugs? Actually, the answer is both. Now, if you have an inhibitor which is potentially not very potent, in the space of FLT3 inhibitors, we have seen some of this with, say, midostaurin, which is perceived to be a relatively weaker inhibitor. Now, some of the patients who relapse after being treated with midostaurin can still potentially respond to a more potent inhibitor if it is, gilteritinib for that matter, which is already approved and available. So that is one scenario. The other scenario is, say, a patient is being treated with a particular inhibitor targeting a particular mutation. Now, within that mutation, certain resistances can develop, right? Say, for that matter, FLT3 is, again, a great example. So FLT3 has two kinds of mutations. It's an internal tandem duplication mutation, or the ITD mutation, or a point mutation. Now, some of the drugs, say quizartinib, which is in development, or sorafenib, which is not a drug approved for AML, but it's commercially available, and it hits the FLT3 ITD mutation. So those drugs, when the patient is exposed to, now you can acquire a second mutation, which is the point mutation. And if you acquire a point mutation, you may be refractory to quizartinib or sorafenib, but you may still be responsive to gilteritinib. It's the same mutation in the same class of mutations, but at different sites in the same gene. So that's where you can be still responsive to another inhibitor in the same class. But then we see situations where you can acquire a completely different mutation and become resistant to the entire class of mutation, entire class of drugs that are targeting that particular mutation. So now we have to talk about combining two different pathways inhibitors to actually address that resistance.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.